All right, guys, so let's get started. Again, my name is Dane Don Millen. I'm the foot care specialist here at Activa Clinics. I want to welcome you guys to the fourth edition of our Activa Wellness Series. We're very happy to have you guys here joining us tonight. If you haven't done so already, please click on the subscription button under the video. This will keep you up to date with any future series we do, as well as try and follow us on Facebook, Twitter, Instagram, and LinkedIn. Keep up to date with all of our services and any kind of promotions that we do every month. Activa Clinics is proud to be one of Canada's leading providers of comprehensive healthcare services. We provide wellness services in the areas of chiropractic care, physiotherapy, massage therapy, acupuncture, orthotics, and foot care, along with laser therapy and much more. We are specialized in WSIB claims, assessments, and MVA rehabs. We accept EHC and private patients as well, with the benefit of dealing directly with the EHC companies as well. To see our full menu of services, please visit our website at www.activaclinics.com. So we're going to get started today, and we're going to be talking about compression therapy and how that helps with the benefits for the lower leg system. So just a little bit of a background on compression therapy. We're going to start off with talking just about some of the anatomy and a little bit of kind of what goes on in the lower limbs with circulation and the lymphatic system as well. We're going to touch base on the different conditions that a lot of patients usually will experience, or they'll know somebody who's experiencing a lot of these conditions. We'll then talk about how compression therapy can help you guys, and then we're going to kind of end off with compression stockings and kind of how to choose them and how to use them as well. Okay, so the how circulation in the body works is we have a cardiovascular system. Okay, it's an organ system that is responsible for the circulation of blood and the transport of oxygen, carbon dioxide, nutrients, hormones, blood cells, and fluid throughout the body. So, the upper body, the lower body. The system includes the arterial system that transports oxygenated blood, okay, via your arteries and capillaries. And then also a venous system that transports deoxygenated blood back to the vein, or from the veins back to the heart. So in this venous system, we have two types of vein systems. We have the superficial, which are closer to the skin, and then you have your deep vein system. Okay, the superficial venous system makes up 10% of our body's composure and can be described as a network of smaller veins primarily located in the subcutaneous tissue layer between the skin and the muscles. The deep vein system, which is located within the muscle tissue, is responsible for transporting approximately 90% of our body's blood, okay, to the surrounding muscles and extremities as well. So typically with the lower limbs, with people that either do a lot of standing all day or do a lot of sitting, we tend to sometimes have a decrease in blood pressure, okay, through those veins that are moving up and down the leg. So one of the most important mechanisms in transporting the blood against this gravity of sitting or standing back towards the heart from those extremities is something called the foot muscle pump or the calf muscle pump. This muscle pump promotes blood transport towards the heart. So when we walk, the muscles in our leg repeatedly contract and relax, okay? And every time these muscles contract, they compress the veins in the deep vein system of the legs. And this helps to promote kind of the blood coming back towards the heart. Inside our veins, we have valves that control kind of the blood flow as well. And oftentimes with poor circulation, these valves get blocked off. And that's why we run into problems, which we'll talk about, like varicose veins and spider veins as well. Okay. Along with your cardiovascular system, we have the lymphatic system. Okay. And this is another network of lymphatic vessels and nodes. And this has to do with a lot of fluid transport. So a lot of our immune system, our blood cleaning, blood filtering, and this is another system that kind of filters into our lower limbs as well. And the lymphatic system basically carries all the waste around the body and recycles all the waste throughout the body. So this is another system that is affected with poor circulation and a lot of these problems that we see with compression therapy. So now that we have a little bit of a background, we're going to talk about kind of the main conditions that yourselves you might be experiencing, or that a family member or friend might be experiencing as well. So one of the most common ones is heavy legs, and what heavy legs are is characterized as a discomfort or pain in your lower legs. The legs may feel achy or they'll feel tired. These symptoms will usually occur when you're sitting or standing for long periods of time, as we said earlier, at work or during certain activities during the day. This applies to all kind of professionals, so people that are working in an office, people that are bus drivers, people that are working doing a lot of standing, construction workers, nurses, so forth and so forth. And basically, this discomfort is caused by heaviness or swollen legs. This means that the venous return in your veins in the lower body is compromised. And as well, the calf muscle pump system that supports this transport of blood from the lower extremities to the heart has not been activated and not working like it should. Okay. And we'll touch kind of how compression therapy will help with this a little bit later. The next condition that we commonly see, it's called spider veins. Okay, it's a little kind of dark little network of veins that you'll see usually around the calf or in the thigh or sometimes behind the knee as well. And what spider veins are they're a small, deep colored vein, basically on the surface of the skin of your legs usually, and then they appear like a branch or like a spider web. Um, they tend to be about 1 millimeter in diameter. Okay, and spider veins develop if the valves on your superficial veins are not working properly, causing the blood to flow backwards and kind of stay stagnant in the veins. Um, Symptoms will include again heavy or tired legs, and obviously just by aesthetic purposes, you tend to notice them more kind of in the leg area. So spider veins are very common for a lot of our patients, and basically again, it just has to do with that kind of venous insufficiency and that blood not kind of flowing back from your lower extremities, back to the heart. Another common one, which is very similar, is called varicose veins. Varicose veins are a dilated or tortuous vein, and basically a little bit, thicker than a spider vein. Tends to be about 3 millimeters in diameter. It can also show up as a kind of a bulge of a vein. The risk of developing varicose veins is tends to be higher in women, people that are obese, obviously ladies that are pregnant as well. Um, Sometimes you can have a genetic disposition to this as well, and also if you lack exercise, and these are all common kind of risk factors for having varicose veins. Varicose veins can form again on the superficial skin of the leg, so in the calves, the thigh, behind the knee, but they can also form deep into the vein and form that kind of bulge. Varicose veins can be painful, and on the contrary, sometimes they can be painless and just kind of be more of an appearance thing. Symptoms that usually present can include ankle and leg swelling, heaviness or fullness in the lower legs, aching, restlessness at night, fatigue, pain, obviously, cramping, and then sometimes also an itching sensation on the skin. After standing or sitting for a long time, these symptoms tend to worsen due to increased blood levels and pressure in the veins of the lower body because that circulation is not working like it should. Also, high temperatures can aggravate the symptoms of varicose veins and spider veins, especially during the summertime, like we just finished off. Another common condition is venous edema. Okay, and edema is basically swelling of the structures of the lower leg, and it's an increase in fluid that comes down into the skin and the subcutaneous tissue. Okay, so applying pressure on edema will usually leave an indentation into the skin. So edema will usually notice as the day goes on. So in the morning, you won't notice it as much, but as the day goes on, whether you've been sitting or walking for a long period of time, the edema will tend to build up as the day goes. Venous edema usually occurs in the ankle region, but it may extend into the leg and foot as well. So, around the knees, sometimes into the thigh as well. There are many causes of edema, such as standing or sitting for long periods of time, as I said, lack of physical activity, chronic venous disease, lymphedema, hereditary issues, being pregnant, having a surgery or trauma very recently. And edema of the venous tissues develops when venous valves don't close properly. So just like how we talked about earlier, because of poor circulation, those valves in the veins close, and then the fluid tends to build up in those areas, causing that kind of visible swelling as the day goes on. Now, one of the more serious conditions that you don't see very often, but it's something to obviously keep an eye on because it can cause it can lead to a lot of more serious issues. Is something called a DVT, which is a deep vein thrombosis. And a DVT is a serious condition in which the blood clot forms in the deep veins of the lower leg or the calf and blocks blood flow kind of back to the heart. DVT can lead to leg swelling, redness, severe pain, but can also occur without these symptoms. DVT can become a life-threatening condition when a blood clot breaks apart from that kind of that clot in the veins and kind of travels back into the heart, and this can lead to obviously a kind of fatal condition of like a pulmonary embolism as well. A lot of times with DVT, it happens with people that have a lot of restricted movement. So if they're kind of at the hospital and they're on the treatment bed for long periods of time after a surgery, if they've had any kind of infection or inflammation due to different kind of conditions, or they've have like damaged blood vessels, and then obviously ladies who are pregnant as well. So DVT is a very serious condition. We don't see it as often, but it's something that the kind of symptoms and risk factors, something that you should always keep on top of, and obviously discuss with your your healthcare professional. Lastly, a lot of the patients we see in our clinic, and a lot of people you will know, will have some sort of diabetes as well. And with compression stockings, diabetic care is very important as well. So diabetic care is something that you always have to keep on top of with not only your family physician, with your specialist as well. So A lot of times with the legs and the feet, it's important to always have a physician take a look at your feet when in terms of swelling, any ulcerations, any cuts or bruises, because swelling is a big part of being diabetic, and compression therapy is an important part of kind of managing a lot of these conditions with diabetes. So again, very important to always, if you're a diabetic and you notice a lot of the swelling occurring as the day goes on, as your activity continues, to either come into one of the clinics or talk to your specialist and make sure that they're aware of that, so that compression therapy can be worked into your treatment for diabetes as well. So we touched on a couple of these common conditions that we see. There are some other ones that are less rare, or sorry, less common. But again, the compression therapy are going to be an important part to help battle kind of a lot of these conditions that we see in the clinics as well, and that you have seen with your kind of family or friends as well. So now we're going to kind of talk about what medical compression is, and how it's going to help a lot of these conditions. So medical compression therapy consists of applying a type of elastic device, mainly around the limbs, and exerts a controlled pressure around them. And by compressing these limbs or body regions, again, it can be even the upper body as well, medical compression squeezes the vein walls and thereby is improving the overall circulation in the limbs as well. And helps basically, the main goal is to help kind of get that blood flowing back to the heart. Okay. So in addition, it helps to reduce the swelling and formation of edema, as we just talked about, by kind of pressing on the kind of capillaries that are involved in our lymphatic system, okay, that we touched on earlier. Medical compression provides significant relief for, again, leg aching, pain, feelings of swelling, heaviness, and tiredness, and then a lot of the conditions we talked about, like the varicose veins and the spider veins. The controlled pressure that is exerted by medical compression stockings helps to reduce the diameter of the veins. So again, we're trying to squeeze those veins so we can get a lot of that blood flowing back out. Okay, we want to basically increase the velocity of that blood leaving those veins from our lower limbs back up to the heart. So medical compression improves blood transport from the extremities. It reduces blood reflux and stagnation. So when the blood kind of pools in the veins, we're trying to reduce that as well. And it provides drainage for a lot of our lymphatic system. Okay, so there's different types of medical compression. We're going to talk about mainly about stockings, but there's also wraps, there's bandages. There's ones that are for the the arms, the legs, the feet, the neck as well. So they come in a variety of kinds. Compression stockings are the ones you guys are probably the most familiar with, and they're the ones that are going to be more suited for a lot of the conditions we see. But again, there's a wide variety of compression therapy that exists in the world there. Okay. So when we talk about compression stockings, so compression stockings obviously involve, the lower limbs. They are basically for your ankle region, your calf region, your thigh region, all the way up to the waist. Okay. So when we have compression stockings, we have 5 different strengths of compression. Okay. And we measure compression therapy in milligrams per mercury. And that just has to do basically with the strength of how much compression we're getting into the deep and superficial veins of the lower body. So we have about 5 different strengths that we see. Obviously, there's custom-made ones for more severe conditions. So we're going to start off with something called 8 to 15 milligrams per mercury. So that's the kind of lowest strength of compression you can find. Now, this is basically an over-the-counter compression that you'd see mostly at Shoppers Drug Mart or Pharma Plus. When you go into your drugstore, usually it'll be on a stand, and these are ones that people are able to kind of try out for the first time if they've never tried medical compression before, and it's something that you don't need a prescription to buy. So these are good options for, again, people that have never tried compression before. They are interested about it. They might just want to use it for kind of their daily activities, whether it's walking, standing at work, or exercise and stuff like that. And this is a good starting point for people that want to kind of dip their toes into kind of compression therapy. So that's kind of your 8 to 15. It's your over the counter or kind of off the shelf kind of medical compression. Okay. Next, which is another over-the-counter one, which is a little bit stronger, is called 15 to 20. Now, this is one that we carry in the clinic as well. Again, another form of compression where you don't need a prescription to buy them. This is something that you can, again, go into any of our clinics, or sometimes you can find them online as well. And this is a little bit of a stronger compression, something that people will always start out with before going to see their doctor, to go for a more medical grade compression. And again, same kind of thing. It's made for kind of your daily activities. They have, we're going to talk about later about kind of the materials that they come in. But these ones are just simple. They go usually by your shoe size. Okay. Whereas the medical compression, we'll talk about some of the measurements we take later on. But a 15 to 20 is, again, a really good accessible compression stocking, that's at a reduced price, but again, because it's not usually covered by insurance, but it's something that if you're interested in compression therapy, usually I would recommend people start off with a 15 to 20. 20. The 8 to 15, you're going to notice a little bit of the benefits, but to really see a lot of benefits for your daily activities, the 15 to 20 is kind of the best place to start out. So, okay. Then we get into our 20 to 30, and that's where you start going into what's called a medical compression. Okay. And basically, your 20 to 30 compression has to be prescribed by a doctor or a physician. Okay. Usually, the doctor has to, do a little bit of a background check and you see kind of what your underlying issues are before they can recommend a 20 to 30 compression. So it's very important that you talk to your doctor first before, planning to, go for a 20 to 30 compression. Again, obviously the strength of the compression is going to be a lot stronger with this one. It's going to take a little time to get used to, but this is one where you're going to see the most benefits for, the conditions we talked earlier, like the varicose veins, the venous edema, the spider veins, the DVT as well. After that, we have two stronger strengths, which we use much less commonly in the clinics. You have your 30 to 40 milligrams per mercury and your 40 to 50. Now, these are usually ones that you'll see more in a hospital setting, following people that have had surgery for a DVT. They've had other surgeries to the lower, and they're going to be spending a lot of time, stagnant in the treatment bed, kind of either in the ICUs or just in the long-term care. So these are ones which are definitely ones that not the average person are going to be using for daily activities, and more so for these more serious conditions that we talked about. But when it comes to all of these different levels of compression, if you're not sure, you can always kind of book into the clinic, and we'll touch base this a little bit later. But we can definitely help you steer you in the right direction of which kind of compression level will be best for you. But also, if you go and see your doctor, they'll be able to help you with that as well. Okay, so a couple things, when you're thinking about going to get into medical compression, that you want to kind of ask yourself. So these are two most common questions: are what are the signs and symptoms that should warrant you thinking about medical compression, and then also what are the kind of conditions that we want to keep you away from medical compression. So when should I consider using compression stockings or to see a doctor for that recommendation? So one should be if your legs are chronically swollen, painful, or fatigued. So you notice that on a more regular basis over a couple of weeks or a couple months. You have poor blood flow in the legs. You have a known risk factor or hereditary predisposition for blood clots, especially in the lower legs. You have a family history of any deep vein problems, obviously circulation or blood pressure problems, diabetes as well. If you've, like we just touched on, if you've been to the hospital and you've had long periods of rest, or not being mobile, you've been kind of in a bed, or in a long-term care facility, and then also if you notice the physical varicose veins or spider veins as well. So those are all situations where if you notice these things either in yourself or in your family or your loved ones, this is a good opportunity for them to go and see their doctor and start asking about medical compression. So a couple of things where we want to be careful or stay away from medical compression. And again, this is very important that you see your doctor for these things, but these are certain situations where medical compression might not be right for you. Is that if you have arterial insufficiency or intermittent claudation, meaning that you get constant blood clots as well, or ischemia, you have uncontrolled congestive heart failure. So that's obviously a big one. Acute dermatitis or dermatosis of the skin. You have signs of infection in the leg, okay? And another thing with diabetes is that for a lot of diabetic foot care, the level of compression is very important. So usually for a diabetic patient, we tend to not go over a 15 to 20 compression. It tends to be too strong for their condition. So typically, if you're a diabetic, it's very important that you go and see your doctor first before getting into compression therapy, because there's only that 8 to 15 or 15 to 20 compression that would be more suitable for your condition as well. Okay. So, very important when you're interested in compression therapy. And again, this is something that we can obviously help you with at any of their clinics. But when you're kind of looking to get into medical compression, really important that you get that prescription first. We can always help you get the prescription, but that's really important that the doctor sees you first and it reassesses you for that level of compression. And then if you have that prescription, it helps us kind of point you in the right direction of not only the level of compression, but also the types of materials and obviously the types of length of compression, which we'll talk about soon, that would be more suitable for you. So that's kind of a background on compression stockings and medical compression. Obviously, like with a lot of our services, with orthotics, obviously, and bracing, I'm working at all the clinics. I'm dealing with the orthotics, the bracing, the compression. So feel free to call in and book in a free assessment at any of the clinics, and I'll be able to spend some time with you. Even if you haven't seen your doctor yet, I can answer some questions for you, before you go to see them, give you some options and recommendations for medical compression and see whether it's suitable for you. So again, these are all common things where if you've not experienced yourself, usually a family or friend has experienced. So we can definitely definitely be more than happy to get you into the clinic and talk about any of these kind of conditions or any of kind of this background knowledge in more detail for sure. So the last section, what we're going to do is we're going to talk about compression stockings, how they look, some of the different materials, the different lengths, how to choose them, how to use them, and then how to care for them as well. Okay. So the most common compression stocking would be something called a knee-high compression. So it's a compression stocking that just goes kind of just below the knee. Basically, we talk about kind of 2 finger lengths below the knee. So it covers kind of the ankle and the calf. And the most important thing to remember with any compression stocking, we're going to talk about a thigh high and pantyhose as well, is that majority of your compression tends to be in the ankle area. And as it goes up the calf and up the thigh, the compression will get less and less. So remember, in the foot area, there tends to be no compression, always tends to be in the ankle area. And basically what that's doing is causing a gradient of compression. So basically, gradient means that by going from an area of high pressure to low pressure, it's helping to push all that fluid and all that blood back towards the heart. So always remember that when you're wearing compression stockings, that there's no compression in the foot part. It starts mainly in your ankle area. That's where that, for better, lack of better terms, it's a little bit tighter in the ankle. And as it gets up the calf and up the thigh, it gets less and less. So for example, most people, on a daily basis, we have a lot of nurses, a lot of construction workers, but even people working in offices as well. Most people, unless you have issues going on above the knee, so your varicose veins or your swelling above the knee, typically you'll be in that kind of knee high, and that also tends to be the easiest compression stocking to get on for people, and people tend to be the most compliant with wearing that one. But definitely, this is kind of the most common compression. Okay, and then we'll touch on the materials once we finish the other two. Your other one, which is hard to see on the screen here, is your thigh high or pantyhose. The thigh high tends to go about 6 inches kind of above the knee. And this is going to be for kind of any issues you're having around the knee or behind the knee, and then obviously up into the thigh. So with your varicose veins, your edema, your spider veins as well. Thigh high compression is, a little bit tougher to get on. Again, it takes a little bit of, a little bit of tricks that we're always going to talk about. And there's some devices that can help as well. But thigh high stockings are good for people that, again, working in offices. They obviously come in more fashionable materials as well. So not as many as options as your knee high, but definitely for certain people that need that compression above the knee, then the thigh high is going to be important for you as well. Obviously, we have ones that go up to the waist. So for people that are having areas kind of more in that upper thigh or around the hips as well, because it doesn't have to happen a lot, but sometimes we can have those kind of cardiovascular or lymphatic system problems, closer to the hips as well. So that's where pantyhose comes into play. And then more of a specialty one is our maternity pantyhose compression stockings, obviously for people that are pregnant as well. So during that kind of those months of pregnancy, a lot of people will have a lot of edema, a lot of kind of the achiness and tiredness as well, and that's where we have a special maternity pantyhose compression stockings for those ladies as well. Okay, so when it comes to different materials, compression stockings, especially in the last 5 or 10 years, have a lot more options for materials. Before, most people will think of compression stockings as more of that kind of nylon spandexy material, like regular women's stockings. Those still exist, and unfortunately, for compression stockings, all compression stockings to have that kind of compression to them have to have a little bit of nylon and spandex. But in the last 5 to 10 years, there's been a lot more options for material. So when you come to the clinic, we can obviously show you samples of these as well. But I'm just going to go over a couple of them right now. You have ones that are kind of made from cotton. You have ones that are made from wool. You have microfiber stockings as well. They come in a bunch of different colors. There's ones that have different patterns as well. Ones that are for different activities that we're going to touch on. So when choosing your compression, and again, this is something that we'll be more than happy to help you with at the clinics as well. But you got to think about what are the the activities during the day, whether it's at work, whether it's with the kids, or whether it's even with your exercise activities. What are the activities during the day where you're doing the most walking and standing, or you're doing the most sitting? And that's kind of determine kind of what material, or obviously what kind of style of compression you're going to go with. And so these are all things I always kind of talk with people, like what are kind of the main activities you'll be using the compression stocking with. That'll kind of help us to figure out would it be better if you have a little bit more stylish compression, so kind of a microfiber, more of that kind of stocking material, or are you using it more practically for kind of exercise, for activities? A lot of nurses, doing a lot of walking, standing, or construction workers, they're going to go for more of that sport compression or that more cotton compression because they are more active. And depending on the material of the compression, you'll have some that have more kind of moisture wicking materials that would be more breathable. Obviously, some are going to be more built for the winter months. So, your wool, your merino wool, your thicker cottons are going to be better for kind of colder temperatures. And then obviously your more breathable ones would be good for kind of obviously this time of year, spring, summer, where we need that compression, but we also want something that's not going to cause us to have a lot of sweat as well. So, there's so many different types of materials and, colors, options. And obviously the different lengths of compression. So when you come in, whether it's one of the PTAs or myself, with an appointment, we can definitely guide you, because yeah, there's it can be a little bit overwhelming with all the different options. So we can definitely guide you into the right level of compression, the right style of compression, and also the right material that would be better for you as well. So with compression, a lot of people will have tried compression at some point and find obviously it's a little bit more difficult to take them off and pull them on. So when you come into the clinic, we always, when people are in the process of getting compression, we'll show them a lot of techniques on how to put them on, how to take them off, because there are just very easy techniques that will help. It will help you a lot with kind of taking them off and putting them back on, because that tends to be the most frustrating thing for most people, is getting compression on and off. Which is so when you come into the clinic, these are all things we can talk about. And then for people that still have difficulty with taking them on and putting them off, there are specific devices that we have. So we have special gloves for compression. We also have specific devices for people that are in wheelchairs or who are kind of bedridden, where they have trouble kind of bending down to kind of get their compression on. We have basically donning devices that are kind of a device with handles that help to kind of get the compression on. And these are all things that we can order in for you and kind of show you how to use as well. So whether you're somebody who's completely mobile, that you just need help with getting that compression on, or you're somebody, or somebody who's kind of at the hospital, or they're just at home in a long-term care setting and they don't have anybody to help them getting on compression, there are options to kind of help them with getting their compression stockings on and off as well. Okay. And then the last thing, and this is something that I'll always touch base with people once they pick up their compression stockings from us, is that, with compression stockings, unlike your regular, socks and stockings at home, there's, special ways to take care of them. And when I say special, we always recommend with compression stockings that you either hand wash them or you put them in a delicate cycle in your washing machine. The more important thing is that I always recommend people stay away from putting them into the dryer as well. The heat of the dryer tends to affect the compression and the nylon and the spandex. So just to keep them lasting longer and to keep them working like they should, I always recommend, if you can hand wash them and hang dry them, that'll keep your compression lasting much longer. Because a lot of people with your EHC coverage, or even when you have a compression stocking, if you're using it 5 days a week and you're going through 1 or 2 pairs, if you really want it to last as long as possible, we want to kind of care for them properly, and that's where really important to kind of hand wash them and then hang dry them as well. Okay, so if there's any questions, I'll be happy to ask them now. Again, for any people who are watching this this live series, today, later, or the next day, we'll be able to put any questions in the comment section. I'll definitely be able to get back to them and answer them in the next couple of days, over the next week. And then again, as I said, to book a free consultation with myself at any of our 6 clinics, there's no charge. So feel free to go online on their website, or give us a call, and we'll be able to set you up with an appointment. I'm at each of the clinics usually either once a week or once every 2 weeks. And whether you know kind of that you need compression, or you just have some questions, you can always even shoot us an email or give us a phone call, and I'll be more than happy to help you. So at the moment, I don't see any questions right now. But again, as I said, if you're watching this a little bit later on, definitely pop some questions into the comment section and we'll be able to help you. Lastly, I just want to thank you guys for kind of joining our series today. Again, as I said at the beginning of the video, we're trying to do these series, quite often. So, please subscribe and kind of like the video as well. It'll help us kind of know that these are working and that you guys are enjoying them. So and it'll keep you up to date with any future series that we do. Again, for any people that leave a comment in the comment section, remember there's a chance of winning a free 30-minute massage. So get a comment in there. Again, I'm going to be more than happy to answer any of the questions that you leave into there. But yeah, if you leave a comment in there, we'll be kind of drawing the prize for the 30-minute massage in the next couple of weeks as well. And we can kind of, if you get your comment there, you could have a chance to win a free massage at one of the clinics. And again, my name is Dane. I'm the foot care specialist. I look forward to kind of talking to any of you guys if you guys have any questions, or seeing you at one of our 6 clinics. And it was, enjoyable talking to you guys. And I just hope you guys have a good evening and a good rest of the week. All right, thanks. Take care.